Delta variant now accounts for 96% of new cases.
We're seeing cases rise, we're seeing rising hospital admissions, and we must reconcile ourselves, sadly, to more deaths.
It clearly has the capability and the efficiency of transmitting very readily from person to person.
Over the last year, a key part of the COVID story has been the story of variants. We had the Kent virus, now known as Alpha, which emerged from the UK. We had the South African variant, which is partly vaccine resistant, now called the Beta, as well as the Brazilian virus, now known as the Gamma. And now we have the Delta, which emerged in India in October last year, which is so contagious, it's muscled out the others and is at least 75% of all infections in countries reporting genomic testing. The hope in Australia is that vaccination will allow us to open up. The UK and the US were hoping the same. They have among the world's highest vaccination rates. But they've had worrying surges in daily cases, with the UK leading developed nations. With the New South Wales outbreak, it's brought front and centre how much vaccination we will need to live with COVID.
We will soon receive that first set of advice from the Doherty Institute that takes into account the Delta strain.
While we wait for our modelling, there may be lessons to be learned from the UK, which has just over 50% of its population fully immunised.
The vaccination programme has meant that the number of hospitalisations for every 1,000 cases is now substantially lower than it was in previous waves, but both are going up.
This reduction in hospitalisation and deaths has been dramatic. The blue line is the actual number of deaths, and the red line is the number of deaths if there'd been no vaccination. It amounts to well over 20,000 lives saved since February.
The final stage of unlocking in England, with social distancing rules dropped. 1,000 people packed into this club in central London, with many more lining up outside.
One debate is whether vaccination allows you to abandon all social distancing measures, which is what the UK government has largely done.
We have infections rising exponentially. We have hospitalizations rising exponentially, albeit at a lower rate. And we have deaths rising. Having large numbers of people in close proximity to each other is an absolute breeding ground for the virus.
One view is that by not keeping social distancing and mask wearing, the UK government is trying to achieve herd immunity by letting the virus rip through the community. But with Delta infecting young people disproportionately, that may be putting them at risk.
But in particular, the problem of long COVID is there. And there's almost a sort of seeming desire to sort of wish it away. Now, the chief medical officer has been clear in warning about the risks of this, but it's not clear that that is penetrating to government.
But it's not just young people. The pattern of spread in the British population has familiar echoes for Sydney and Melbourne, with spread in disadvantaged suburbs.
The highest rates and the greatest difficulty in controlling the pandemic have been in the most deprived areas.
The United States has suffered worse from COVID than any other nation. But now, with high vaccination rates, the US, like the UK, has seen lower rates of deaths and hospitalizations overall. But that's not evenly spread. The United States shows the effects of remaining unvaccinated even more dramatically than the United Kingdom. The US Delta surge is worst in unvaccinated states, the southern states.
It's time to start blaming the unvaccinated folks, not the regular folks. It's the unvaccinated folks that are letting us down.
Alabama is the least vaccinated state in the US, and cases have nearly doubled in the past week and are 4 times higher than 2 weeks ago. Dr. Scott Harris is the state's chief health officer.
Alabama's reputation for, poor race relations is probably known in your country. It certainly is in our country. And so we have a lot of mistrust to overcome, a lot of mistrust, frankly, that, state government has earned because of its behavior in the past. We have a lot of people that don't have access to health care. We have really kind of only bare bones coverage. And so we have a lot of risk factors for how a pandemic could get out of control really quickly. And there are a lot of people who just, because of the political turmoil we've experienced in the past couple of years in this country, just aren't interested in hearing from government or hearing from the media or hearing from, experts who, are trying to give them, our best advice on how to stay safe and healthy.
Which is ironic, since the US has bucket loads of free vaccine for those who are willing to be immunised. So what's the message for Australia from countries like the UK, which are ahead of us in vaccination rates?
We need to recognise that the Delta variant is not a nice variant, and we have failed to control it with measures that were successful in controlling the Alpha variant. You're having the same problems at the minute. And so I think just take it very, very seriously.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.